Good morning, everybody. I'm Dr. Allison Arwady, Commissioner at the Chicago Department of Public Health. Thank you so much for joining us. As always, this is your opportunity to get your questions about COVID answered directly. Today is Tuesday, October 5, 2021. We started just a couple minutes late because we were moving lots of things around. I do want folks to note that later today we're going to be doing a stand-up press conference with a particular focus on schools. I'll be standing up with the new CEO of Chicago Public Schools, and we'll be talking about that situation. Normally we do that at 1 o'clock, but because there are some federal officials in town, a lot of various things happening with media, we'll be doing that a little later at 4:30. So if you're interested in that, I encourage you to join us then. As always, you can put your questions directly into the box below or use the hashtag AskDrArwady on either Facebook or Twitter. And we will start with our Chicago data. You go to Chi.gov/COVID-, and let's pull that up. And you see the news really continues to look good at this point here in Chicago. We're averaging 355 cases per day, down 6% from a week ago. 14 hospitalizations a day, that's down really very nicely. Still averaging between 4 and 5 deaths a day, and that is typically the indicator that we see come down last. So I expect that'll be another couple of weeks if we continue on this trajectory before it's down to where it was prior to this smaller Delta surge. Our vaccinations administered are up a bit here, 5,714, although some of that is due to people getting their booster shot. And certainly I know people continue to have questions about that, so put those in if you have questions about boosters. We're testing a lot, almost 20,000 a day, 19,540. You can see that's almost exactly flat from last week when we were averaging 19,447 per day. And what's good about that is we're doing almost the exact same number of tests, but seeing a 6% decrease in cases. So that's part of how you know that this is not just due to changes in testing. And then with that, our positivity rate, which is impacted both by positive tests and by how much testing we're doing, continues to drop, 2.3% compared to 2.5 a week ago. And you can see, looking back here, that it was early August was the last time we were this low in terms of positivity. So everything looking really promising there. I'm going to also just pull up a few slides to highlight some specifics. So first of all, for the travel advisory, Connecticut is coming off the travel advisory. So you see most of the country is still quite deep in the Delta surge. We've never changed the definition of what puts a state on our list. Basically, if the state is at either substantial or high transmission, as defined by CDC, approximately 15 cases per 100,000, they're orange on this list. And so California is doing the best, along with Connecticut and Puerto Rico. We don't have any states that are 1 week below 15, so it'll likely be another week or 2 weeks before we're actually able to remove additional states. But slowly, the averages are coming down across the country bit by bit. So slowly but surely, making progress. Here is how our current numbers fit into Chicago's community transmission and risk matrix. So you see our cases diagnosed per day remain in that substantial transmission category. And CDC does ask that between the substantial and the lower risk, if either your cases or your positivity are in high or substantial, you're considered to be insubstantial. But our positivity here at 2.3% decreasing is great, and both our hospital non-ICU and ICU capacity are looking very good and on the way back down, and we have seen those move back into lower risk, so good progress. Obviously, case rates remain much higher among unvaccinated Chicagoans compared to fully vaccinated Chicagoans. Someone had asked last week about people who had gotten one shot but not their other yet. They're not included on this graph, just to keep it a little bit simpler. But where we have shown this, their number kind of runs right in between these, all the way up and down here. So for people who are unvaccinated, as in not gotten any vaccine, you can see we're starting to see some decrease in cases there. And then similarly, a very nice decline in terms of some of these breakthroughs here. And that's just because there's less COVID around. So that's exactly what we expect to see. Again, if everybody were vaccinated, we would be in pretty much full control. And there are some countries in Europe, if people have been following, that are are nearly fully vaccinated when it comes to their eligible population. And there are some settings that have been able to drop really all COVID restrictions at this point. Portugal, for example, virtually every one of its people, old enough to be vaccinated has now been vaccinated. And the US has dropped, early on we were among the top in the world for vaccination rates because we had the earliest access to vaccine. When I looked at this late last week, we're down to 48th among countries in the world where we look at the percent vaccinated. And so there are a lot of places that are a lot more vaccinated and are having fewer cases, fewer deaths, fewer hospitalizations. And then we're starting to see some that are, vaccinated enough that they're able to lift restrictions entirely. So it's good to see that. I wish we would, get a little further up that list than 48th. And there are some countries that are not even high-income countries now that are starting to pass us. Across the world, more than 40% of people in the world have now gotten at least a first dose, which is good progress. But some of the poorer countries are still lagging a lot, and there's a big gap there. Anyway, hospitalization rates here in Chicago, you can see this is where we start to see more significant difference. So many of these hospitalizations, unfortunately, in people who are unvaccinated. But as expected, we see those rates declining among both those who are unvaccinated and fully vaccinated, but the risk remains so much higher here in Chicago for people not vaccinated, and then deaths the same. And here, what you're seeing is those unvaccinated deaths are actually continuing to rise. That's that lagging indicator. There's a lot of people who are unvaccinated who have been in the hospital now for a number of weeks, and some of them are now starting to pass who are unvaccinated. So that's what we're seeing here in Chicago and around the country. As a reminder, Protect Chicago 77 is our citywide campaign. Our goal is to make sure 77% of eligible Chicagoans age 12 and up have at least started their COVID-19 vaccination series by the end of the year. You can see when we ran this late last week, we were at 72.9%. So making some progress there. I'm not I would like us to get to a point where we're fully vaccinated, 77%, but at least the first goal is that 77% have started. So good progress there. And this is what this looks like by map. So this is by community area, not just zip code. As you know, all zip codes have hit at least 50%, at least the majority, which we're excited about. But there are some community areas that we see more variability. So in the darkest blue here, you see there's zip codes that have hit more than 77% already, have gotten at least that first dose. And then in the lightest blue are where we either have less than 45% in that southernmost in Riverdale, although some of that may be related to Cook County case counting, and we'll double check that. But otherwise, the next lightest blue are 45 to 54%, where we continue to put a lot of effort. But really good shout out, particularly on the northwest and the southwest sides that have been some of the areas hardest hit in terms of hitting that 77%. And then this is the completed series. So, in the same way, here's where we are in terms of that first dose. I want to see as much of this map as possible, 77% of eligible people complete the series. And currently we're at 66.9%. So you can see there are a few community areas that have hit that 77%, but most have not. And we still have a good ways to go there. I want to congratulate some neighborhoods that hit important milestones for Protect Chicago 77 over the past week. Austin, Avalon Park, and Grand Boulevard all hit 60% in first dose vaccine coverage. Humboldt Park hit 70%. Brighton Park hit that 77% mark. And then East Garfield Park had the biggest increase in first dose coverage among ages 12 plus. So congrats to those neighborhoods. Let's keep it going. I also just quickly wanted to remind you that you can find all of the Chicago Public Schools data, cps.edu/COVID. We'll talk a little more about CPS data this afternoon, but I just wanted to, again, let you know some of how we're thinking about this and put this in context. So since the start of the school year, we ran this yesterday, there have been a total of 0.46% of CPS staff and students, so 4 to 5 out of every 1,000, have had a positive COVID test and been present at a CPS facility during the time they might have been infectious. So starting 2 days before their symptom onset, or if they don't have symptoms before their positive test. So 0.46% 0.46%. And in the last 2 weeks, it's been 0.19%, approximately 2 out of every 1,000 staff and students. So on a weekly basis, still just at 0.1%. Very good, no signs of concern there. Similarly, the screening numbers, and remember, these are for people without symptoms. Last week's screening test results had 25 positive tests out of more than 11,500 that were done across more than 500 schools. We saw 0.21% of those being positive, 2 out of every 1,000 tests performed, and cumulatively, you see the numbers there, 39 positive for the whole school year out of more than 21,000 that were done, and again, 2 out of every 1,000 tests performed. So that is really in line or even below what we might expect for positivity. It's lower than what we see in a lot of other school districts, and there are, most importantly, no signs of unrecognized spread at this point. And we're going to be working to ensure that screening of unvaccinated persons is prioritized, because we really want to make sure that where you're setting up screening testing, CDC recommends prioritizing and really testing only people who are unvaccinated, given that they are certainly at the highest risk. And then obviously continuing to promote vaccination. So we'll be hearing some more about this, but this is all publicly available on the website, and I just want you to know how we think about it for putting it in context. Quick reminder, because we're already getting some booster questions. Boosters at this point only recommended for people who received Pfizer for their initial vaccine series. So if you got a first dose and then a second dose of the Pfizer vaccine, and it's been at least 6 months since that second dose, we're talking to you. You should receive a booster if you're over 65 or anybody who lives in a long-term care facility, and you should receive a booster if you're 50 to 64 with underlying medical conditions, if you got Pfizer in the past and it's been 6 months. You may receive a booster if you're 18 to 49 with underlying medical conditions, or 18 to 64 and you're at increased risk of exposure because, for example, you work in a high-risk occupational setting or an institutional setting. And Moderna and J&J boosters, we actually do have dates now for the beginning of their evaluation. The FDA has shared that their advisory committee is going to be meeting on October 14th to start the conversation about Moderna booster, and October 15th to start the conversation about the J&J booster. And so really, as expected, probably just in these next few weeks, we will have some specific guidance for people who got Moderna and J&J. And as a reminder, for public health purposes, if you need to show proof of vaccination to get into a setting for your employment, quarantine, et cetera, you continue to be considered fully vaccinated when you've completed the primary series. It's flu season. We're just starting to see the very first few cases of influenza getting diagnosed around the city. Before we get fully into flu season, we want people to get that flu vaccine. So regardless of whether and when you have had your COVID vaccine, everybody over the age of 6 months should be getting a flu vaccine every year. So you can go to Chicago.gov/flu or Chi.gov/flu to find out where you can get the flu or the COVID vaccine. As you see here, we've got a little ad campaign going. This is the combo you don't want, flu and COVID together. And just to kind of highlight this, today, for example, CDPH, and this is all available online, we've got clinics going at the 2nd Ward Aldermanic Office, the 13th Ward at West Lawn Park, the 28th Ward in JLM Life Center. You can register, you can walk in. These are for flu or primary COVID vaccines, so Pfizer or J&J. But then we also will be having on 2 Saturdays in October, 2 larger clinics that have more capacity. We'll be offering flu to people of any age over the age of 6 months. We'll be offering the COVID primary series, and we also will be offering the COVID booster dose. So Saturday, October 16, we'll be at Wright College, Arturo Velasquez Institute, and Kennedy King College, and then the next Saturday we'll be at Daly College and Truman College. So again, thanks to city colleges for being willing to open up large spaces and offer some opportunity. But you do not have to come to one of these sites. You can get your flu shot, walk in at virtually any pharmacy across Chicago, doctor's offices, lots of opportunities to get your flu shot. And you can also get your COVID booster, your Pfizer booster if you're due for it, at pharmacies, at your doctor's office, et cetera. And just a last reminder, the state of Illinois' eviction moratorium for people who, have had financial problems related to COVID, et cetera. The eviction moratorium ended on October 3, but Chicago tenants still have financial and legal options to help them remain in their homes. So just because you get a notice of eviction from your landlord, it doesn't mean you need to leave right away. You should be getting legal help if you need it. You can go to rentervention.com. That's the Lawyers Committee for Better Housing. The Department of Housing of the city does fund them to be able to help with legal situations. And then also there is some financial help that is available. So you can apply for emergency rental assistance if you qualify at Chicago.gov/eviction. So if you know anybody who's facing that situation, please make sure they're reaching out to see if there are resources, because if we can, ideally get some financial help or legal assistance there to make sure that landlords are getting paid, but also that tenants are not being evicted, particularly as we head into colder weather. We'd love to do that as much as possible. Okay, let's turn to your questions. All right, Mary Kay on Facebook is asking, hi, can a person who is diabetic get the booster? Yes, and in fact, a person who is diabetic should get the booster. That is one of the underlying conditions that has been highlighted. So definitely, if you're over 50, you should get the booster if you have diabetes, for example. And if you're in that 18 to 49-year-old group and you have diabetes, you may get the booster, is what they say. So I think depending a little bit about the rest of your situation, I am generally encouraging people, if you have an underlying condition, to go ahead and get that booster. Okay. Couple people here just following up on this. When will the Moderna booster be available? What's happening with J&J? So let me just review that again and put a little more context on it. So the FDA, the advisory committee to the FDA, is meeting October 14 to look at the application for boosters for Moderna. And there's a few things happening with Moderna. For example, my understanding is one of the things they're considering is there's a slightly lower dose of Moderna that's being considered as well. So there's a few things that they're looking at. But just as has happened for everything that has been approved to date, authorized under an emergency use authorization or has gotten that full biologic license, first thing that happens is the advisory committee for the FDA meets, looks at all the data. We obviously will be sharing that same data here with you. It's publicly available. You can watch the deliberations online if you're interested. The FDA then makes its recommendation that basically risk-benefit should a booster be offered. And then after the FDA has done that, the CDC meets. The ACIP, the Advisory Committee for Immunization Practices, again meets, looks at the data, and then gets more specific about the recommendations, the specifics of the timing, the specifics of the groups, et cetera. And then the CDC looks at the advice from their advisory committee and puts out the final recommendation. So what we have seen is that typically the time frame from when the FDA starts looking at it till the CDC gives the go-ahead has been in about a week to a week and a half range. So my expectation is that we'll start talking about we'll start talking about Moderna October 14th, and perhaps a week later or so, we might have recommendations specific around boosters for people who got Moderna. J&J, they're going to be talking about October 15th, so that very next day. And I don't know for sure whether the CDC will look at both of these. We'll see. The bottom line is I expect by late October, probably around the 21st, 22nd, 23rd, we will have guidance around timing and what to do next for people who got Moderna or Johnson & Johnson as their first vaccine. So I hope that helps clear it up. And if you've got more on that, definitely ask. Jesse Akins on Facebook is asking, do we take a booster every year? So we don't know the answer to that just yet. Where there are a lot of vaccines actually that have a pattern of when you're initially vaccinating somebody, it's actually fairly common to have a first dose, a second dose that follows quite closely, and then a third dose that is 6 months later. So that's the initial series for the HPV vaccine, for example, although sometimes they'll now do it as a 2-dose. And so this may be something where you're doing the first, you're doing the second, you're doing a booster 6 months or more later and we're done. But I don't know for sure. And a lot of this depends on how much we continue to see variants and mutations. The technology is there that if we continue to see variants and mutations, we can be adjusting. But I cannot tell you for sure whether this may end up being something like the flu vaccine, where there are so many mutations and changes and strains every year that every year there is a different vaccine to protect against the strains of influenza that are the most common in the 6 months prior. That's not where we are right now with COVID, but certainly as we're following people and we see, these folks who have gotten the booster shots, they're seeing really good improvements in their antibodies, 10, 12 times that antibody improvement. How long that persists, I think, is one of the things we'll be watching. And then the other thing is that, as you've heard me say a lot of times, people who have both recovered from COVID and gotten a vaccine seem to have the best protection of anybody. And so, could we see some recommendations around that? It's possible. So, as I've said many times, we will continue to show you what the studies are showing, why the recommendations are being made, when they're being made. But as of right now, nobody is saying that you would definitely need to get a COVID booster every year. It's the first time we're recommending a booster at all, and that is because of data out of Israel, but also here in the US, that was showing, especially among older people and people with underlying medical conditions, we were seeing more breakthroughs, right? With Delta, we were seeing some more hospitalizations and deaths. And so the last thing we want to do is when we have a highly effective, safe vaccine, potentially not be boosting it, especially for those groups at highest risk. So if people have more questions about that, happy to talk about it. But no, this is not saying that you will need it every year. Okay. James McKay on Facebook says, regarding the program where Chicago Department of Public Health comes to the home of elderly shut-ins who can't get out for a COVID shot, is there any way flu shots could be administered at the same time? Thanks for the fantastic service and expertise. It's very comforting. So good question, James. Right at the moment, we are not doing that, but we're talking about it. Flu vaccines, it's obviously quite an expensive service for us to be offering, but we think it's important. And to your point, where we've been thinking about, right now, just to be super clear, the Protect Chicago at Home is only available for the primary COVID series, okay? So for people getting their first dose, or if they got Pfizer, their second dose of vaccine. Right now, we are not yet offering COVID boosters, and right now we are not offering flu shots. But we are talking about exactly that group. There could be, for example, the people who we started the Protect Chicago at Home, the people who, as you know, are really unable to leave home. Might we consider a COVID booster at home down the line? We might. But we are not administering flu shots at home really at this time. And, we're going to continue to explore this. We're the only big city that I'm aware of that is offering this still universally. And we continue to see the slots fill. That's the other thing, with people getting their primary COVID series. And so those are the people we most want vaccinated. So that's where we're keeping those resources right now. Flu vaccine is very, very, very widely available. Pharmacies, doctor's office, lots of clinics. As you see, we're doing it at aldermanic offices, lots of places. But thank you for that suggestion, and certainly thinking about how we ensure people who have a lot of barriers to get vaccinated. We've learned a lot about that during COVID, and moving forward, we'll continue to think about that. All right. Steve on Facebook says, I read about a new pill to treat COVID-19. What is this, and how is this different from others? All right, great question. So this was a few days ago, but this was pretty big news. So previously, to treat COVID, okay, so this is not to prevent COVID, this is to treat when someone has been infected with COVID, the only authorized medications that we had, remdesivir, has the full approval, and then we have 3 different basically antibody concoctions that can be given that have emergency use authorization. All of those have to be given really IV, so into the vein, or for some of the antibodies, there's a subcutaneous version. But the point is, they're hard to give operationally. People generally have to go into a center. You have to get them. They're designed for people who have mild or moderate symptoms, who are not hospitalized generally. And the idea is to try to prevent hospitalization. There was an announcement just a few days ago that Merck was able to stop a study early, and I'll talk about that actually, for a new medication, Merck with Ridgeback. Those are the two pharmaceutical companies, and this is an oral, so a pill antivirus for COVID. It's called Molnupiravir, and that is the generic name. And basically what it showed is that there have been a number of studies looking for a pill. This would be equivalent to, there are pills that you can take if you get diagnosed with influenza and it's early, that help decrease the risk of people being hospitalized. So, if we're seeing people in clinic and they have underlying conditions and they just started feeling bad and they've just had a positive flu test, we definitely give them, we prescribe this pill for flu because it helps keep them from getting hospitalized. And there's been a lot of work to try to recreate a pill form of an antiviral for COVID. It does not replace the need to get a COVID vaccine or a flu vaccine for that matter, but it's this additional piece that you can add. So in this study here, this was a double-blind study. I know we've talked a lot about this, but let me just remind you what that means. This was a study done all over the world, and behind the scenes, you assign half of the people to get the real pill that they are testing and half of the people to get a placebo, a dummy pill. The patients don't know which ones they got. The doctors don't know which ones they got, who are actually seeing the patients and running the study. But behind the scenes, they then follow people forward and see how they do. They see of people, the people who were enrolled, again, are people who had mild or moderate COVID, who were not yet hospitalized, but who had risk factors for being hospitalized. Also, this study started early enough that it was folks who were unvaccinated, so even higher risk there. But there's an additional follow-up for, you would also think about using this certainly for people who are vaccinated and may have breakthrough, but still high risk of hospitalization or death. And so the way it works is there's a data safety monitoring board, and behind the scenes, they are looking for any concerns related to safety, or they're looking to see, while the study is going on, are you seeing results that show it's clearly not working or it's clearly working really well even before the trial is finished? And so in this case, there was an interim analysis where they found that of the people who had been randomized so far, there were about 370, 380 in each group. And when they looked about a month after that randomization, of the people who had gotten the drug, 7% of them had been hospitalized or died. I think only hospitalized. I don't think anybody died, actually. And then in those who got placebo, 14% of them had been hospitalized or died. So it cut in half the risk of being hospitalized or dying when people got this pill. So that was a big enough effect that the Data Safety Monitoring Board said, yeah, it looks like there's something to this. So the company will be submitting that information to the FDA, so it is not available yet, and it'll go through this same process of looking at the data, et cetera. But if this checks out and the data is looking like what the preliminary results look like, it would be really exciting to have an oral version that if people are getting sick, it doesn't replace vaccination. We got to definitely keep getting people vaccinated. But if they have a breakthrough infection, or if they're not vaccinated but at high risk, it could help really cut those risks of hospitalization and death. So that was really exciting. All right, we've got a question from Kristen Korkowski on Facebook. Could you advise on healthy lifestyle and coronavirus? I've been hearing good stuff about B6, boosting your immune system. I know about vitamin C and D. I take all precautions. I'm vaxxed. I only spend time with fully vaxxed friends and family. Every little bit helps. Any thoughts on Nosin? Okay, Kristen. So first of all, the most important thing that I'm reading in there is that you're vaxxed and only spending time with fully vaxxed friends and family. That is by far the most important thing you could be doing to limit your risk from COVID. In terms of boosting the immune system, So, what I recommend to my patients, like I was in clinic last night, and I will sometimes check a vitamin D level, for example, knowing that up here in Chicago, we don't get a lot of sunlight. A lot of my patients may be vitamin D deficient. I do like to sort of see where people are so that if they're needing more specific vitamin, I can make that recommendation. Generally, if you're eating a good, well-balanced diet, you should be getting the vitamins that you need. But where people are supplementing with a daily multivitamin, or for example, vitamin D or vitamin C at recommended doses, I think that can help. Related to Nosen, so if people don't know what that is, Nosen is an over-the-counter little swab that you can swab in your nose, and they market it as something that can decrease carrying infection. But I want to be really clear about this. It doesn't work for viruses, it works for bacteria. And even for bacteria, it may not always work. So where this idea comes from is that particularly in long-term care facility settings, we sometimes have problems with drug-resistant bacteria that can emerge. And in that setting, we will sometimes try to use more often a prescription, but sort of this idea that can we decolonize, can we get some of those drug-resistant bacteria to not be in healthcare workers' nose, for example, so they're less likely to spread it to people who are at really high risk. But COVID is a virus. Influenza is a virus. And what is in that swab is basically alcohol, honestly, and a little bit of emollients, things to try to put some of the moisture back. But what alcohol mainly is trying to kind of dry things up. And I honestly do not recommend using that, especially not in a prophylactic way around COVID, et cetera. If your doctor is recommending it for something else, of course, but I don't want people thinking I should get that and trying to be swabbing my nose, because your natural defenses actually are the mucus in your nose, right? That is also part of your immune protection, and I don't really want to see people trying to do that or trying to do washes or any of that. The most important thing in terms of preventing COVID is the vaccination, exactly what you're doing. And then in addition to sort of vitamins, I actually put a bigger stress on what else are you doing that's healthy, like getting some exercise as much as you're able to, being out and about, working on sort of your stress levels and your socialization, right? All of these things that actually are part of living healthy, sleeping enough, eating a balanced diet. Those, to my mind, are actually even more important than vitamin supplementation, and definitely more than trying to do bacterial decolonization when what we're talking about here is a virus. So I hope that helps. Stephanie Whitfield Smith on Facebook says, thanks for a heads up on early flu. I don't recall it being mentioned. Likely there was so little flu circulating. That's right. We had almost no flu season here last year because what were we doing? We were masking, distancing, washing hands, and in that setting, saw very, very few flu cases. We did see some, but in terms of like ICU admissions, for example, which is what we typically track, off the top of my head, maybe we saw one across all of Chicago in the series, whereas normally we see hundreds. So a very, very minimal flu season. And again, we usually see flu season really kick into high gear here, sort of in the November, December, January, February timeframe. Most of the time, October is a great time to get vaccinated. That's before it kicks off really high level typically. But also people are out and about more than they were previously. Certainly, the masking, these things that we are doing also continue to help against other viruses. But nevertheless, I do definitely want to see people get their flu shot. I was really happy actually at CDPH. We had an on-site clinic where, like for our employees, where we were offering flu vaccine, and for those who were eligible, we were offering COVID boosters, and we saw by far the best flu uptake we've ever seen. Like hundreds of people getting their flu shot all at once, plenty of people getting COVID boosters, and it makes me glad to see people take advantage of that. And I encourage you, you can walk into a pharmacy, make an appointment, you're not going to have to wait, it's quick and easy, and it all gets fed into the same system. Sarah Garza on Facebook is asking, how long does the flu shot last if you took it in September? Should people with a compromised immune system take another flu shot as prevention? Good question. No. You're fine if you took it in September. You're fine if you take it in October. The point is you want to take it every year, and generally you're then considered protected sort of through that flu season. For people who are older, over 65, or sometimes if there's an immunocompromising condition, depending, sometimes there's a slightly higher dose flu vaccine that can be given for seniors. And so that is what I would recommend for people who are over 65. Again, that just has to do with your immune system not being quite as robust. And so would recommend that for anybody who is older, but otherwise, no, you do not need to be getting multiple flu vaccines in the season. And thank you for getting your flu shot. Getting it in September, getting it in October, all good, and it should last you throughout this flu season. Renee Henry from Facebook, is it safe to get the vaccine if I had severe side effects to COVID? Renee, I'm not entirely clear. Are you asking, like, did you get sick with COVID and you were unwell, or you got a COVID vaccine and had side effects and you're wondering about the flu vaccine? So if you want to clarify that, I can address it. Either way, if you had a bad case of COVID and you were sick, okay, this is the same person here. Okay, so she's saying she had COVID. And she's been crazy, yeah, really had a lot of symptoms with COVID and has been worried to get the shot. Okay, gotcha. So yes, you should take the vaccine. So because you had COVID and you had a lot of symptoms, that tells me that you have some immunity there, right? That is good, that is helping. But having had symptoms from COVID does not make you more likely to have side effects around a COVID vaccine. When I got my COVID vaccine, I was very lucky. Like literally all I had was a little bit of a sore arm. Most people who get the COVID vaccine actually do not have side effects. Okay? But we want to be very transparent that when people get the COVID vaccine, sometimes people, can have for a day or two. They can really not feel good. And we do see some people, a relatively small percentage of people, getting a fever or getting chills, et cetera. But I would encourage you to get the COVID vaccine. Like you heard me say, really the best protection, probably the best long-term protection, is when people both have the kind of protection that you get when you recover from COVID. You get those antibodies, and then you get the vaccine. That's the same advice I give, to my coworkers and friends who have had COVID. Yeah, I know, and I'm sorry you had COVID and got really sick from it and have been having these issues. Long COVID is another thing we worry about. So you're saying you've maybe had symptoms that have been going on for a few months, and there was just a study out that showed, almost a third of people in this big study were still having some COVID symptoms, more than 3 months after being diagnosed with COVID. And what we have seen, actually, this was unexpected, was that there are some people who have some of these long COVID or sort of extended symptoms who get the COVID vaccine, and actually their long COVID symptoms get better. So especially for someone like you who's had some lingering symptoms, I particularly recommend getting the vaccine because that could help with that. So good question. All right, we're getting a few questions here about holidays. Lisa Balde Venaria on Facebook says, our family's starting to make plans for Thanksgiving and Christmas. Advice for holiday gatherings. Patty Craft is wondering about what's happening with boosters and young children, December holidays. Okay, so let me tell you, here's how I'm thinking about this. Last year, October is when we started to get into some trouble here from COVID here in Chicago. That was not the Delta variant, okay? That was the OG, the original COVID virus, but it was spread this was the big surge that started in October and took us through November, December, January. It was the worst that we saw in terms of cases. And it was the surge that was before vaccine was available, right? Like partly into that surge was when vaccines started to be available. So as you've heard me say, I have been confident that because at least half of our folks are in every zip code are at least partially vaccinated, I'm not anticipating, seeing an enormous surge like that, but I am a little worried. I think what was driving that was us moving inside, frankly. We know there's a reason that influenza season happens every, late fall and winter here, and we could see that with COVID. I am hoping not, right? But I cannot guarantee for sure. Delta, we're coming off very nicely here. It's been a little bit slower, but it's good. And boy, we did not get hit hard with Delta compared to most of the areas around us, and I've been very pleased by that. So from my standpoint, you know, if we continue to see cases like at the rate where we are right now, and especially if you are gathering, if everybody's vaccinated and you're gathering, go for it, in my opinion, right? Like, we'll let you know sort of what's happening related to case counts, but this depends a little bit. Are you here in Chicago when we're under pretty good control? Are you going somewhere else where we might be in less control? And I know it's hard to not have that full answer, but it wouldn't be responsible of me to say, I know what's going to be happening for sure at the end of November or at the end of December. You know, we'll have a better sense in early November of where, you know, kind of where things are and where things are going. And I think, you know, if we get to mid-November and generally things are relatively calm, you know, I am certainly way more optimistic about the ability to have safe family gatherings than I was last year. Kids, let's march that out. Kids, if you didn't hear, October 26th is our day there. The FDA has said they are going to be taking the first look at childhood Pfizer vaccines for 5 to 11-year-olds. The advisory committee is starting that process tentatively October 26th. So if we say maybe a week later there, we could have the first vaccines available. We are likely, maybe, going to be able to start vaccinating 5 to 11-year-olds early November. Pfizer, you know, and we'll have to see for the kids, but for the adults, it was on a 3-week spaced schedule. So you're talking about, you know, right around Thanksgiving is when kids have the potential to have been vaccinated, but then there's technically 2 weeks post that second dose. So from an opportunity of having kids vaccinated, you know, I'm more confident in Christmas there than I am Thanksgiving. But if all of the adults are vaccinated and generally you're being careful about it, you know, if Thanksgiving were in 2 weeks, I'd say no problem. We'd be talking about how to be, you know, limiting that risk, and we'll keep you updated as we, you know, as we get closer. Yeah. That's how I'm thinking about it, and we will keep you up to date there. Go ahead and, you know, make some tentative plans would be what I would say, but recognize that it's possible guidance could have to shift. But I'm feeling reasonably optimistic right at the moment. Okay, thanks so much for joining. If you're interested in more about CPS, like I said, we'll be doing that stand-up press conference today at 4:30. And for those of you with 5 to 11-year-olds, spread the news. October 26th is when we're hoping things will kick off in terms of looking at the Pfizer vaccine. Thanks so much for joining. We will be back on Thursday to take more of your questions. Bye-bye.